Speaker, thank you very much. And Mr. Speaker, I beg to move the following motion. That aware that the county health services, including promotion of primary health care, is one of the functions devolved under the fourth schedule of the Constitution of Kenya 2010, appreciating that the community health volunteers, CHVs, play a crucial role in community health strategy by linking the community to health services as provided in the Kenya Community Health Policy 2020-2030, further appreciating their role in creating awareness among the public on non-communicable diseases and their risk factors, basic preventive measures and detections of symptoms, deeply concerned that these community health volunteers, being a critical component in health services provision, have not been well facilitated to undertake their roles, as most of them struggle to afford the monthly NHIF cover, recognizing the need to improve the welfare of the community health volunteers so as to enhance effective health service delivery across the 30 wards, noting that the Kenya Community Health Policy 2020-2030 stipulates that although community health volunteers are recruited to work on a voluntary basis, counties are, however, required to pay them stipends and compensate them for their time in any other way that would motivate them to continue providing this important health service to their respective communities, including support, supervision, and provision of commodities and supplies. This Honorable Assembly urges the County Executive Committee member for Health Services to 1. Look into the welfare of community health volunteers through compensation to enable them afford crucial services such as NHIF cover. 2. Formulate a community health bill to provide for the welfare of community health volunteers in accordance with the Kenya Community Health Policy 2020-2030. Mr. Speaker, this motion is geared to once again address the rights of the community health volunteers. And Mr. Speaker, you know, every member in this assembly knows and appreciates the good work that is done by these people in our wards. Mr. Speaker, a few years ago, Nyeri was ranked as the #1 county in the whole republic in non-communicable diseases. This one we were even given the UHC pilot status, Mr. Speaker. Therefore, the good work that these people are doing cannot be gainsaid. But Mr. Speaker, you find that the small remuneration that has been coming, in fact, it doesn't even come at the end of every month. So what we would urge the health department is that these people should be getting something at the end of every month. These people should be given something considerable. You know, it's not payment per se, but appreciating them. For example, Mr. Speaker, if they are paid for, even HIF is paid for them, Mr. Speaker, because these people, you always go there in the village, you meet them everywhere. Even now I've come from various in my ward, they are there, you know, assisting people. They need cards, they need commute allowance, you know, so even giving them, the least they should be getting is between 3,500 and 5,000, depending on what the county can afford. Because then, Mr. Speaker, it is not good that these people will go there, then we expect them to go back to their pockets, then, you know, to finance all those routes they do in our wards. That is why, Mr. Speaker, I wish to urge my colleagues to recognize this good work they do. And Mr. Speaker, I think we have had almost a similar motion in this assembly. But like what's happening, I never even had a reply about, the decision of what was taken over the matter. But Mr. Speaker, this time around, we have said it's a new start. And in the likely event that members of this assembly approves this motion, we shall follow up, Mr. Speaker, so that we agree and we see to it that the department takes good care of these volunteers. Therefore, Mr. Speaker, without much ado, I wish to call on the Honorable Member for Konyo Ward, the Honorable Kameri. Yes, I hear he's being called by the Elder Daktari, Mr. Speaker, so that he can also contribute to this and urge my honorable colleagues that we come to the aid of our brothers and sisters, provide these crucial services. I thank you very much, Mr. Speaker. I beg to move.